Everyone, the session is going to start, so we please request you to take your seats immediately. We request all the students to make it faster and come back quickly. Hello and welcome back to the third session of today. I am Jeevotham and I'm studying my first year MBBS at the Sri Madhusudan Sai Institute of Medical Sciences and Research. As for the third technical session, we have four panel members and I'll commence off right now. And the topic or the theme for this panel discussion is making healthcare services affordable and accessible. As our moderator, we have Colonel Karyappa. Colonel Karyappa is an ex-military public health specialist. He is an active member of the Indian Public Health Association and the Epidemiology Foundation of India. Our first panel member is Dr. K. Madan Gopal, who is the Advisor Public Health Administration, National Health Systems Resource Center. He'll be joining us online. Our second panelist is Dr. Anuj Bhatnagar. He is the Head of Public Health at Tata Steel Foundation. He has served in the Indian Armed Forces as a public health specialist officer for 24 years prior to joining Tata Steel. As the third panelist, we have Dr. Rajendra Gupta, founder Health Parliament and was the former advisor to the Health Minister, Government of India, and a key contributor to digital health initiatives across the globe. The last panel member is Dr. Rajiv Tandon. He is an expert in public health and currently serves as the director of RTI International, India's health program. He also has alliances with UNICEF, Wish Foundation, McGill University, and KLE University, among the others. Over to the moderator.
Thank you for the kind introduction and welcome to all the panelists. Without much ado, given the shortage of time that we have and the important topic, it's about utilization of health services in the government system and accessibility for people as such. I'm going to ask our colleague, Dr. Madan Gopal, who's joining us online, about the strategies and existing exemplars of best care practices that exist for delivery of government healthcare services. Dr. Madan Gopal.
Thank you. I think I am audible. Yes. Okay. Thank you, Dr. Karyappa, for this question. Because if you look at the way things have progressed over the last many years, we have been focusing on strengthening of the health systems. And we have been able to successfully strengthen that. But the uptake of the system is now the focus. If you look at all the government programs, the whole focus and the impetus is on saturation of the programs and the schemes. We have seen that the exemplar study, we did one exemplar study which has shown that the intervention which the government has been doing is yielding results, which is seen in the form of reduction in the mortality indicators and other things. But right now, the focus is now that how to saturate it. You have seen few examples. The concept of saturating the utilization of the services. We have been providing services, but we have to make more efforts in reaching the last mile and saturating that services. One of the first initiatives we started for the saturation efforts in the health system was the aspirational district program of Niti Aayog. And you see how the uptake of the services in the 112 aspirational districts has shown us the way that the saturation approaches would be the key for at least improving the health services and uptake of the services. Then after the success of this aspirational district program, now you see the launch of this aspirational block program. These are two things. Apart from that, there are other major programs which are the cutting edge at the local level. That is screening for the NCD, the screening for tuberculosis, as well as sickle cell, as well as improving the uptake of the PMJ program. For this now, the efforts are made through the Ayushman Bhav program that this was started on 17th of September. It will continue till 31st of this. After that, the Viksit Bharat Yatra, wherein the whole focus is on saturating the uptake and utilization of the services. The third other important aspect is PM Janman program is also there, where more focus is given on improving the uptake and utilization of services in the primitive and vulnerable target groups, tribal population. So that means overall, the system is in place. Now we are making an all-round effort through these various schemes for improving the utilization and uptake of the various programs. I stop here.
Thank you, Dr. Madan Gopal. When we're talking of saturation of the services being provided by the healthcare system, Dr. Bhatnagar, what do you feel about the bridging of the gaps that result? And what role can NGOs play in such bridging the gaps that are there in service?
Thank you, Dr. Karyappa. That's a very, very valid question. And I will take this opportunity to maybe dwell upon this subject using some of our public health programs that we run in Jharkhand and Odisha, some of the most underserved communities, from Tata Steel Foundation. So, one of the things that, and I go back to what Sadhguru had said in the morning, the 3S. So we have to understand that without the involvement of the society, without the involvement of the institutions, without the involvement of the government, nothing much is forthcoming, and nothing much would be achievable. So what we've done is that we have a large-scale program which is reaching almost 4 million lives in Jharkhand and Odisha, which is called MANSI. It's kind of acronym where it stands for Maternal and Newborn Survival Initiative, presently in its 12th year. This program is a program with a difference. When we were planning this program, there was very close coordination with the government. The government of Jharkhand is an active partner, is a signatory to the MOU. We have other partners like American India Foundation, etc. But the basic thing is that, as a development expert organization, Tata Steel Foundation has a role to identify the gaps, the critical gaps, and try and bridge these gaps. I will take 2 examples here very quickly in the interest of time. During COVID, we realized that the frontline health workers, the ASHA workers in Jharkhand, they were not able to reach the last mile, or they were not able to cover the number of households that they should ideally be covering. Because we have to understand that they wear saris, the geography there is very, very challenging. There are hills, there are rivers, there are rivulets, and they have to ride a bicycle up the hill, down the hill. So we realized that there was a need in a manner how to bridge that gap, the crucial gap of the last mile being reached. So we looked at some of the like-minded organizations, and we partnered with one of the organizations in giving them e-scooters. So we gave them 650 e-scooters in some of the most challenging areas. The impact of that is now getting visible, where we are finding that these frontline ASHA workers are able to reach far into the interiors, the depth of the geographies where they were earlier not able to reach. That is one example of how that critical and crucial bridging of the gap takes place. The other example I would like to quote here is that we realized, and this was again our intelligence coming from the field, with our work with the frontline health workers, that again due to the geography, and again what Dr. Srinivas was mentioning in the morning, we have geographies where pregnant ladies, they have hamlets beyond a hill. They have to cross 2 hills, 3 hills on foot to reach the nearest labor room, to reach the nearest delivery point. And often it was happening that they would feel the pains, they would reach a facility only to be told, these are false labor pains, please go back, come back when the actual labor pains start. And there is no facility for them to stay nearby. So they would trudge back all the way, and maybe 2 days, 3 days, 5 days down the line, when the actual labor pains would start, A, they would not have the time to reach that facility, and B, most of them would not have the wherewithal. So possibly they had money only to go once. So that is where the accessibility problem came in. So we picked this up. We worked very closely with the district authorities, and we told them, identify the 3 worst areas where you feel that this is a problem. So the district authorities, the civil surgeons came back to us with geographies, and we have developed now a birth waiting facility which is one of a kind, which has been identified with the state government and is being taken pan-state now, where we've developed a kind of infrastructure, a 10-bedded infrastructure, where pregnant women can come and wait, both pre and post-delivery. So that is the time when they're close to the facility. This has directly resulted in pushing up the number of institutional deliveries, which is also a major KPI for us, because we know that we would like to reduce the domiciliary deliveries to the extent possible because of the attendant risks and the attendant complications post-delivery. So the government has come a step forward. They included this model as, they said, you put in the capex, the government is going to put in the opex. So it was a surprising thing to us when the government stepped forward and said, we are including this in the PIP plan of the state, we are going to look after the OPEX part, the operating part. The state government went a step further. They said, we are going to post trained manpower to these centers that you are developing. We are going to post a 108 ambulance because they said that we do realize there are going to be ladies who are going to be having difficult labor, going to be having complications, and they will need to be evacuated to a higher center. So this is how, Tata Steel Foundation, as part of Mansi and as part of our field operations, we feel that there is a lot of, potential to create synergy, to create very impactful and meaning synergy when the government and the NGOs or the development partners, they work together. Thank you.
I think that was very briefly captured in a very nice way. I'm just going to tell for the benefit of the young people in the audience. This bridging of gaps is the same way those who are taking ice cream. If you didn't have that spoon, the government is providing the ice cream, but you didn't have the spoon, how would you be able to take the ice cream out from that big dabba that is there? So this part of bridging the gap needs us to keep our ears open, our mind open. Dr. Bhatnagar brought about examples and learnings from the system from the ground level. That is what, whenever anyone is in position of policy making or decision making, they need to listen to the voices from the ground for the need that is there. So moving on, Dr. Gupta, I'm going to ask you about what strategies, that is, you can include leveraging technology, what strategies can be employed to enhance utilization of government health services which are already existing by the people?
Thank you, Karan. So before I talk about this, let me first ask you, do you know what is the rate of a specialist consultation, and typically like a neurology consultation, which is really very difficult to get, in the government telemedicine program called e-Sanjeevani? Can someone give me the exact price that you can get this e-consultation on by a neurologist in e-Sanjeevani? Anyone can raise hands and just say that number? No one? So this Colonel brings to fore an important point. We had 120 million consultation. It's absolutely free. So a service that's needed, you need consultations from top doctors. So within the doctors in the government system, they're supposed to be providing free consultations by e-Sanjeevani. So people are not aware of the government schemes. And trust me, I hear on this forum, I had a role between 16 and 18 advisor to Union Health Minister. Sometimes I feel a little perplexed that government really doesn't do anything, which is not true. It does a lot of things. But having said that, what strategies? So first, let me also answer you, what is the number of population that needs that? Why do we need people like NGOs? So you will get a complete perspective of that. So today, the simplest number that comes to anyone's mind, that 81.35 crore people get free food from the government, will keep getting for next 5 years. So the simplest thing is 58.10% of the population needs healthcare facilities. They are vulnerable in my eyes. But that's not a very simple thing. I'll tell you a story of a person taking you back in 1997. A class 1 government servant, served the government for 3 decades, suffers from cancer, a T4 stage cancer. All the money goes in the treatment, being a class 1 government servant. And the day she dies, 28th April 1997, her son didn't know where to get the money to do her last rites because there was a dead body but no money left. And that was me. So I'd seen the other side also. So an APL family becomes a BPL family in a matter of minutes. So a disease can be debilitating, it makes you vulnerable. There are a lot of government programs. First, we need to understand how many people need it. So the ecosystem is really big. One side, you have the defined so-called 81.35 crores. On the other side, you have even people who are having a good job, but they end up having a debilitating disease and they end up becoming BPL. It can happen to anyone. We have seen good families getting into this problem and asking for raising money to serve that patient. Now, how do you take this thing? Like 120 million consultation, none of us know that it's free. So these forums are very important. Today, at least I know that if someone asks you that can I get a free consultation, you can say e-Sanjeevani. Just download the app. This is a government telemedicine platform provided by CDAC Mohali, and you can do a free consultation. So the first thing is forums like these have a very important role. The second thing is media. I still believe media has a very important role to play. Coming out with success stories like we saw in the morning, it compels you to say, how can I contribute to the Sai Sansthanam? If they are changing life, they are giving the lease of life to people. Same way, government is doing too many things to change the lives of people. Well, of course, a lot needs to be done. There is the Pradhan Mantri Jan Arogya Yojana where you can get insurance for up to 5 lakhs. People have got for other diseases more money. So the success stories need to be also discussed. So that's one. Then getting role models. I think government has also lapped on this opportunity of getting people like Amitabh Bachchan and others to talk about it. But there are community participation. I think in the first half we have seen that at the end of the day, health is about community. If they do not know, what do we do? I still have spoken to people, and I tell you that some people are not aware of the PMJY scheme. They suffer from disorders. And the government has a scheme for them. So I would say 3 things. Platforms like these. If you are educated, your job, someone who works at your home or knows, you can tell them government has a scheme. And you can actually take them to the website. There's a dashboard. Everyone can see it's in multiple languages. One can download the ABHA app and create an ABHA ID. Your first doorway into the entry for government schemes. So already 49 crore people have downloaded the ABHA app, the ABHA number, the Ayushman Bharat Health Account number. So already people are aware, but people have not utilized the scheme. That I agree. For that, you have to reach out to communities. I think wonderful work done by the Sai Sansthanam. Media has to portray a story because still all that you say and do, people still read newspapers. So I think we need to bring out those success stories, how people benefited. And then the last one which I see is most impactful is, why can't we create a chapter about the key government programs in the schools? If the kids learn, they will tell their parents. I have done that when I was working. I told Mr. Nadda that let's create a booklet. So we created a booklet, a 10-page for what are the do's and don'ts for children. And the other minister in the education, Prakash Javadkar, both of them launched the booklet. So health and education have to work together. And I think this have to drill down to primary school to tell people what are the programs of the government at the basic level. This will be the best way to reach the people that we want them to reach. Thank you.
Thank you, Dr. Gupta. That was very lucidly brought out. The issue of partnerships, intersectoral collaboration. I'm going to turn to Dr. Tandon now to ask him with his long experience about partnerships and relationships. How can partnerships between NGOs and the government health system work better towards promoting health for all?
Thank you, Dr. Karyappa. So at the outset, I'd like to thank the organizers for inviting me to this very illustrious group of experts, and it's been absolutely an honor to hear everybody since morning. As people have been speaking since morning, health has been practically looked at not only as curing a disease, but also preventing the disease, promoting better healthy lifestyles, looking at now health in all age groups. India is growing in its demographic dividends to now being also having a large number of elderly. So how do we look at them? As was mentioned, government has innumerable programs. Government funds these programs, provides human resource, provides medicines, provides trainings, provides monitoring methodologies. But in spite of every possible effort that the government does, and when I say government, I'm talking about the central government, the state government, the district government, and even down to blocks and local governments of panchayats, there are communities which are always left out. As was mentioned by the initiatives that the Tata Trust did, Mansi, there has to be a catalyst between ensuring government programs and reaching those to whom it does not reach in appropriate, timely, quality fashion. With that understanding, the largeness of India, 1.4 billion people, and large pockets of unreached, migrants, tribals, insurgents. Now you have some vulnerable communities with LGBTQs. You always need a group of committed, championed, dedicated people in the form of non-government organizations or platforms. What is possibly also required since morning. We've heard people talk of community-based organizations. We've talked of large Tata Trust Foundation like non-governmental organizations. I represent an international non-governmental organization, and you have more. One major challenge between the government and all its programs, leaders, politicians, bureaucrats, technocrats, and all of them, and this other group is a trust deficit. Unfortunately, the government feels that they can do it all. They have created a system, they have ashas, they have everything that we've been talking of. And why do you need the others? The others realize, because they are on community base, they are in hard to reach areas, they are in those aspects of healthcare provision which government is not being able to achieve, they feel what we are doing is really the most important. What we have realized, sir, over the years is you do need platforms at different levels which need to be institutionalized. The big challenge is who will lead these platforms. When you have a trust deficit, you have a situation where if the government is saying something, the NGOs are thinking something else, and if the NGOs are saying something, the government is perceiving something else. Where should these platforms be? And lot of efforts have happened. There were coalitions, there were alliances, there were what were called action solution hubs at different levels. One example that I would take, and possibly everybody knows of that example, is an area called Gadchiroli. An iconic husband and wife couple, Dr. Abhay Bang and Rani Bang, and their phenomenal effort of what was called home-based newborn care. And this was an excellent evidence-based model which was developed by the people for the people. But if you look at the way it has moved, and it has not been able to reduce newborn mortality or morbidity over the years, is because of this trust deficit. When Abhay Bang, the iconic legend, would share his data at global platforms, the global audience would hear it. But when he needed to share it in India, there were always issues and challenges and so on and so forth. So one is a institutionalized platform where the whole of society comes, and possibly organizations like these, people like Sadhguru, who are well-meaning. Since morning what I've been hearing is everything that has been developed has been based on donations, has been based on just commitments to a cause with him as a leader. Can these organizations play that trust-building role between government and NGOs? The other is you have millions of NGOs which have been mentioned, not all as successful, not all as effective, not all as efficient in accessibility, availability, affordability of healthcare provision. The ones who have been successful have somehow had champions, sir. Whether they have been individual champions, whether they have been institutional champions, whether they have been perceived championing, but you do need champions. And I'd just leave these two ideas. Having platforms at different levels of multiple partners, some catalyst who would build trust between all of them. And the idea that's coming to me is, an example is this institution. And then from the NGO side, champions who then can reach based on evidence, showcasing what they're doing.
Oh, wonderful. Dr. Tandon, you brought it out so succinctly. You have summarized the whole thing actually. I'm just, in the interest of time again, I'm just going to be asking all of you to consider on WhatsApp, that ubiquitous social media platform that we all have. We receive so much of information, most 99% of which is useless for us. But do we ever forward anything that is good or news which is worthy of sharing. Maybe that's one platform that can be done. On that note, I'm going to ask my panelists, how can governments and NGOs leverage digital modern technology to reach out information to people for better utilization of health services? We can start with Dr. Madan Gopal if he's still online.
I'm online. I'm listening to. It's always pleasure to listen to Dr. Gupta, so because he has been there for the digital thing. But you have seen how the digital technology it has brought people together. In Delhi also, you have seen WhatsApp groups of the resident welfare societies, even apartments also, colonies also. They are now having WhatsApp groups, as you have rightly mentioned. And whenever we are trying to build any technology, bringing any technology, it has to be like WhatsApp only. Nobody has taught us to run the WhatsApp. We have learned it ourselves. We now know how to send the messages across, what to forward, what not to forward. That we are learning. Because whatever technological things which we are doing, that should be building capacities as well. And in fact, it is dividing the, it is making things very faster. Even in the government setup also, apart from the emails, we are now increasingly using such kind of communication so that the reduction is very less. And we know that the person has received the communication which I want to send, and the response is also very, very fast. That's one thing. Second thing is, when during the ongoing this Ayushman Bhav campaign, which is more or less giving emphasis for saturation of the government scene, lot of non-government organizations, they are also coming forward. It's not that the government can alone do all the things. There are certain spaces, as Tata Steel Foundation has pointed out. This birth spacing thing is for improving the institutional coverage, and that has been there in the PIP, and it has been agreed in the PIP. If such kind of things are being identified, I think it would be a win-win for all the things. But main problem of the trust deficit only comes then when if I want to push the agenda, it's not the wider agenda for the welfare of the people. But nevertheless, you see how the digital things are come to stay. The e-Sanjeevani platform which has been mentioned, the COVID was a good opportunity wherein the digital mechanisms and other things were leveraged. You see, before COVID, when the telemedicine practice guidelines were not there, and that was an opportune time when the guidelines were released, and now you have seen spurt into these telemedicine and the digital activities. And the consultation is happening, but main problem is how to create more awareness about the utilization of this. Here comes the role of the non-governmental organization to propagate the schemes which the government is having, because as Dr. Gupta has rightly pointed out, we have to tell the students that these are the schemes which are meant for the welfare of the people, how to see that this utilization happens. You say the PMJ program. In some of the states, the Sai Foundation is, you see that how good work they are doing. Government itself looking at the good work. I know many states, the Haryana, Chhattisgarh government, the other governments, they usually call on the Satya Sai Foundation that you just treat our patients also. So they are also part and parcel of the schemes. But that kind of credibility and other things are to be built in. So, and the confidence will follow in that.
Dr. Gupta.
So on the social media, it's always a twin-edged sword. Yeah, the government's role is more of a steward, but what I look forward is, in fact, this September in the Global Summit, we had to launch a campaign called Neither Share Nor Learn, because there's a lot of long information that gets floated in the social media which can be more harmful. The point here is, there are two platforms I would strongly recommend. One is the National Health Portal of the Government of India, which anyone who wants verified, trusted resources, like the Indian WebMD version. Of course, of not that league, but government was seized of the opportunity. In 2016, this was launched. I think this is something that we should propagate more. At the International Patients Union that we run, we have worked with WHO, with the Drug Control General of India, who's an excellent person. And you'll be surprised that there is no OTC list in the country, and we have OTC product. So on 30th November, we held a webinar with Drug Control General of India, with all the people who mattered, and said, the AMR problem starts. I'm giving you a classic case of information, that AMR starts because people have started popping pills like candies. It starts with OTC, becomes into AMR, and this is across the world. So if we are able to educate people, and the third important thing, what message are you giving to people? Like, I think you made a very important point that we get tens of messages on WhatsApp, how valuable they are. You stop reading after some time, you block some people. So let's be very clear that let's start with messages which are helpful for people in their everyday life. How many people know that SR tablet should not be broken? Not many people know that. Sustained release tablet should not be broken and consumed. So what we have started doing as Patients Union, if you look at that page, is that we have started giving people basic information which is verified. Now, we know it's Patients Union page it's coming, but how many people can start doing something just reverse with a similar name? So I think the challenge will come is like, how do you get verified pages to give out information which is scientifically true? It's medical science at the end of the day. It's not entertainment. So I think government has a big role, but you should have to understand government is also thin on resources in terms of trying to do everything. So people like Tata Steel or the Sathya Institute or others have to join hands. But how far can we go? I think we'll have to set self-regulation, decide the challenges, the opportunities, and the goals. So I think start with nutrition. The diet is not nutrition. So you have to give actionable messages. If you don't give actionable messages, it reminds me to a function that WHO organized, and I went there as chief guest. And there was an app for to quit smoking. And what I did before going to that function is I downloaded the app and used it. And I went to the dais and said, if I use your app, I'll quit the app, not quit smoking. Because your apps are not, the messages are not actionable. So if you give actionable messages which are scientifically proven, people can use, see changes, that will drive people to trust your platform, whether it's WhatsApp or it's Twitter or it's Meta. So I think we have to define that before starting to think to use WhatsApp.
Very pertinent point brought out. Dr. Bhatnagar?
Yeah, thank you. I'd like to digress a little bit from there, and being an implementing agency would like to highlight, how we've leveraged, technology, digital technology in saving lives in some of the most underserved areas. So as part of our program, we have what we call the Operation Sunshine, which is a unique app which we have developed. It's based on our handheld machines that our field workers use, where the high-risk mothers and high-risk babies are followed up in real time. So if a visit has to happen today and it does not happen today, a home visit, a physical alarm actually goes off in the control room. We have in the system the details of every beneficiary. Almost more than 60,000 women have been saved. The lives have been saved because of this one little app. So it is not only just giving information, it is not only just an MIS, it is not only just a data collection point, it's an app, it's a platform which solves problems for us. So that is the beauty of this app. Now I'll just like to delve a little bit more that what were the unintended benefits of this. So we all know that ASHA workers are quasi-government functionaries. They're given an honorarium, and that honorarium is across the board the same. So we took this point to the state government and said, we told them that, look, we know that a high-risk case, managing a high-risk case takes more time, it takes more skill, it takes more effort on the part of the ASHA worker. And it would be good if the state government could have a kind of a staggered, incentive-based thing where, somebody who's managed to save a complicated case would be given more incentive. So the state government came back to us and they said, we have no visibility on that. We have no details. So here was the app which we took to the government, that we have the details of the case, we have the follow-up, we have the ASHA workers with her phone number, who's following up that case and what is the outcome of the case. So now we've been approached last month by the state government again. They want to onboard, this particular part of the high-risk monitoring and the follow-up onto their statewide app that they have. So it's a great thing if we can come up with such kind of digital technology and leverage this kind of digital technologies to solve problems. Because being just an MIS, being just a data collection center may not work anymore. I mean, your Excel can do it. But if your app or if your platforms like this, e-platforms like this, can solve problems, that is what I think we should encourage in the times to come. Thank you.
And I'm just going to add one little bit here that when we are developing technology solutions, we should not be a part of the problem. We should be a part of the solution. The poor ASHA, the ANMs, the health workers at the front line, at the last count, I think there were nearly 17 apps, if I'm not mistaken, or 17 software verticals which needed to be filled in for the same information almost, because everyone wants to have their own information. So technology should be an enabler. That's the only point I'm going to make here. Dr. Tandon, what do you have to say about utilizing digital tools for providing information to the people as such about schemes and programs?
Sure. Thank you. what I feel, and this is something we are sharing through a global coalition that has been created called Transform Health, which is looking specifically at the digital story, is again, whenever you're talking of digital, there is a digital human interface. There is a digital human interface on the side of the care provider, and there is a digital human interface on the side of the beneficiary. It is not that the app or the dashboard or the HMIS or the behavior change or the data that was collected happened of its own. Whenever usually digital discussions happen, the people who are championing those discussions are people with a lot of experience on the digital side. So the communication that they are talking of is very digital, technical aspects which miss out the behavioral and social science and human part of it. The finding that is coming out now is that whenever you're looking at digital, and I loved the examples that were given, COVID was a great success story. But the success story of it was not only COVID. It was the people behind it, the training behind it, and so many other things. Basically, the end diktat that is coming out is the need to build robust evidence, having people with digital expertise and behavioral science expertise on the digital human interface on the supply side and the demand side. There are success stories all over. But at the same time, as we've mentioned, not all of us read WhatsApp. If you go to a block, there are multiple computers lying with no computer operator. People don't know what to do with HMIS data and so on and so forth. So I think there's need to build that evidence with robustness and with rigor.
Wonderful. We're going to have to summarize here now and wrap up the session because the next part has to continue. So I'm just going to leave with this last sentence by saying that especially when it comes to dealing with information in this era of technology and instant connectivity, all of us must think, pause, and then only act. This is especially when it comes to forwarding messages on that WhatsApp or other social media platforms where it concerns health. Because misinformation, disinformation are dangerous for the lives and health of people. So thank you so much. I'm going to thank our panelists. Thank you for your valuable contribution and your time, sir. Thank you so much.
With this, we come to an end of this session. We're indeed thankful to the panelists for their engaging and thought-provoking views and ideas. May we now invite Dr. A.R. Raghupati, sir, Director of Sri Madhusudan Sai Institute of Medical Sciences and Research, to present our token of gratitude to all the panel members. Dr. Anuj Bhatnagar, Dr. Rajendra Gupta, Dr. Rajiv Tandon, and Colonel Karyappa. We now request all the panel members to pose for a group photo. Thank you.